I know we've seen a lot of things relax, like for telehealth, that's really opened up the gateway for that, from 2% to 70% greater adoption. But, as we think about remote monitoring and digital therapeutics and what's happening in the home and in the community versus the brick and mortar, how do you think reimbursement fits into that equation and when?
So you got to remember, reimbursement's full open right now, right, from us. We got to remember reimbursement is about parity and licensure and, 1135 waivers and everything that kind of goes into it. And all that's been incredibly relaxed, over the last, couple months or so because of COVID-19. You also have to remember that the pandemic's probably going to be with us another 12 or 18 months, probably at least another 12 months, until we really start seeing a vaccine that comes with it. Because remember, the virus is also mutating, right, as well. And so even though we're working on a vaccine right now, is it the right vaccine, right? So there's a lot of different things that are at play right now. So we don't see that reimbursement going back to anything close to where it was before. I think there was like 23 states that were in a compact for licensure that anybody could monitor anybody within those 23 states. Right now, it's fairly open.
Yeah,
right? The 1135 waivers are open so you can monitor anybody else. I'm pretty sure that's going to stay, right, from that. The only reason why you would pull it back is the level of protectionism, right, to protect the healthcare workers in your state, but it really doesn't, right, do that. It opens you up to actually monitor other people in other states. And then parity, where whether you're in the office or whether you're remote, from that you get the same billing fee. That's pretty much in operation today and allowing you to bundle other fees with it as well. I don't see that completely going away either, right, as well. So what's the negative side that's going to go away? They had requirements a lot of times from originating site, like it had to be video or it had to be, from a healthcare location back to another healthcare location. That's been kind of taken away. I don't see that going back as well. What's going to push this is consumers. The interesting thing about this is that the resistance that I saw a lot of times to reimbursement was that 2%. It was the healthcare industry, even though the AMA was involved in this, was the healthcare industry saying, we don't know how to compensate our doctors. We don't know if our doctors are going to like this, right? We don't know how they're going to be able to take care of patients in the practice and still be at home. And now with that 70%, they're like, shoot, I want to do this.
I should have done this 6 months ago. Damn.
Or 6 years ago. Yeah.
Right. Exactly. Yeah. Better yet.